hello, so today I want you to meet my very good friend here, Terence. Terence is a very hungry bird. Do you know why he's very hungry? Because he was born with hydrocephalus. Hey, so let me tell you the rest of the story. You see, this guy, Kelly, he's very smart. He doesn't have a head, but he came up with this concept whereby he said that our head, like our skull, is fixed. And inside there, we have blood, we have cerebrospinal fluid, and we have brain. So in case any of those increases, there will be an increase in blood, in intracranial pressure, or one of those tissues will have to give way, okay? That's why we might come up with something like brain aneurysm. Yes. So, and because of that, we're going to talk about increased intracranial pressure. It is caused by head injury. Yes. And another important cause is hydrocephalus, because of my dear friend here, Terence. And cerebral edema, of course, space-occupying lesions like tumors, abscesses, aneurysms, and stroke. Increased blood pressure also can cause that. And if you don't know anything as a doctor, always say idiopathic. Yes, so idiopathic intracranial hypertension can also cause that, and medications always, of course, that is always a cause. And then, so one important thing we must know about increased intracranial pressure is the symptoms. So how are we going to master all the symptoms? So number one, remember our bird, Terence. This look at him, is very beautiful. He's very pretty, right? Yes, let's see why he's pretty. So we have this mnemonic called HVVS. So the H stands for headache. And when you see something red, that tells you something is pain, it's painful. It's dangerous, it's painful. So headache, which is mainly frontal. You see my bandana here. I specifically put it in the front of my head so that you will always remember that the headache will be frontal, and it will be worse on lying down. Okay? You see, Terence is always very sad, but red as a headache, always lying down. It's not a good story, by the way. And then the next thing is V. The V stands for what? Vomiting. You see Terence as a yellow beak, and vomit is always yellow, so okay, not always yellow, but this yellow color will always remind you that they'll be vomiting. And he's a bird, wakes up very early in the morning, so it will be a early morning vomiting. Okay, it will be projectile. You see the way this beak is projecting, so it will be projectile. And then the second V will stand for visual disturbances. I mean, you see that high? It's not okay. So the visual disturbances and papilloedema, of course, you will remember that because it's associated with the highs, and the pupils will be unilaterally or bilaterally dilated. Okay. Right, and then the next letter is H. We say HVVS, so S stands for seizures. Of course, there will be convulsions. And then triple C, HVVS, triple C, fontanelle. Triple C, the first C stands for Cushing's triad. We already said it's triple C, and when you say 3, that is triad, and that is Cushing's triad. And Cushing's triad means that your blood pressure will be elevated, your heart rate will go down, and your respiratory rate will be irregular, or you'll have apnea, okay? And then the second C is cranial nerve problems, especially cranial nerve number 6 and number 7. Okay, and then C is for consciousness. I really doubt if this bird is conscious. Hello, hungry bird. Terence, how are you? It's not responsible. He's unconscious again. So fontanelles. You see here, this is a bulging fontanelle. That is a feature that we see in infants. Okay, because the fontanelles are not yet fused. Okay, so we're going to treat this intracranial hypertension. And what are we going to do? We are going to do P normal S. P normal S. What does that stand for? P. We're going to position our head 30 degrees. Because we're also supposed to avoid, obstruction of venous return. From the head. Yes. Normal stands for normocarbia and normophamia. We have to maintain that. P normal S. The S is for sedation, with or without muscle relaxants. Okay. And then S. The second S is seizures. The third S is sodium. Seizures we use phenytoin. Sodium, you have to keep in mind your SIAD syndrome. You all know that. And then V and S. We said P normal S, V and S. The V will stand for 3 V's. Here we have three things. V fluids, ventilation, and valsams. So V fluids, we use mannitol or 3% normal saline. Ventilation, we hyperventilate, because hyperventilation causes vasoconstriction in a side to reduce intracranial pressure. And then third is valsams, anticonvulsants, okay. And then nutrition, that is N, and S is surgical. Surgery, I mean, we have to do surgery, of course. So hydrocephalus is CSF increased and ventricular enlargement. Causes we have acquired, like infections and tumors, meningitis, etc. And then congenital, like the one that Terence was born with, like stenosis of the aqueduct, scary and vocal formation, myelomeningocele, and obstructing lesions inside the ventricle, on the walls of the ventricles, or outside the ventricles, but causing a mass effect on the ventricles, okay? And then classification, we've just done that. Could be communicating, non-communicating, obstructing, non-obstructing, acquired, or congenital. Symptoms, you see Terence here. So Terence was born with it. So in early infanthood, what did he experience? He big head, of course. So there was rapid head enlargement, and then the fontanelles, as you can see here, was enlarged. The sutures, as you can see, it was separated. The scalp veins, as you can see here, it was enlarged, okay? And then the thin skull bones, as you can see that, and poor head control. And then late infanthood, what did he experience? So the frontal, remember my head. So the frontal part of the head will be super big, and the eyes will have issues. So the cranial syndrome, yeah. So that is where the pupil is like round. There's an this abnormality whereby it cannot have an up gaze. So like you see this chart here. So this is a setting sun sign. In a setting sun sign, like the pupil is down here and the upper lid is retracted. So this is how its eyes is gonna look like. Okay, it's a complete opposite of what you're seeing here. You know what I mean? Terence, I'm very sorry. And of course, since Terence is red, meaning pain, it means that he's going to be very irritable because of the pain. There'll be very serious cry, high pitched, because he's a bird, and angry birds, what they do, they really cry with high pitched sounds, okay? And then there'll be lethargy. You see, it doesn't have any legs. There will be lower extremities spasticity, as you can see, no legs. And Terence, can you listen to me? Can respond? So there'll be unconsciousness, okay? That is hydrocephalus. Treatment, how do we treat hydrocephalus? Diuretics, acetylazamide or furosemide, okay? We can also use antibiotics, okay? And we can also use anticonvulsants, of course, those are symptomatic treatment. And surgery, lazima. We must do surgery, of course. Ventricular shunting, okay? We can connect the shunt to the ventricles and then to the peritoneum or to the atrium, or where else? Lumbar to the peritoneum, okay? And bring the excess CSF. And that is it. We just have no other option.